Welcome everyone. Let me introduce my PhD topic, which is improving the success in a surgery of chronic medullary diseases. My name is Kata Illés, and I'm working in the Department of Laryngology, Head and Neck Surgery in the Bajcsy-Zsilinszky Hospital next to my PhD work. And my vision is to use the most effective therapeutic options in the field of medullary surgery, and my mission is to investigate these options and create a high level of evidence. I have two ongoing projects. The first one is about mastoid obliteration, and the second one is investigating the predictive factors of the success rate after tympanic membrane reconstruction. And both of them, I choose the methodology of systematic review and meta-analysis. About the first project, the mastoid obliteration decreases the recurrent and residual disease. So the cholesteatoma is a squamous keratin colonizing squamous epithelial originating from the tympanic membrane, and while it grows, it can destroy the surrounding bone structures, and it can cause serious life-threatening situations. The incidence is 3 to 12 per thousand population, and the treatment is always surgical. The recurrence rate could be high, even 35%, and therefore we would like to compare two techniques, the conventional method called canal wall-up technique and the obliteration technique, and our aim is to evaluate the effectiveness of the mastoid obliteration. So our clinical question is, what is the mastoid obliteration effectiveness compared to the conventional methods? And here you can see the PICO framework. And the primary outcome is the recurrency and residual rate. And secondary outcomes are the hearing results, quality of life, and complication rates and operation time. Our hypothesis is that the mastoid obliteration reduces the recurrent and residual disease compared to the canal wall-up technique. Here you can see the methods which we were used, and during the systematic search we used 4 databases, and the date of the search was in October. And during the selection of the articles, the Cohen's kappa was almost perfect, and we found 11 eligible articles to our project. Here you can see the main outcome about the recurrent and residual disease, where we compared to these two techniques, and we calculated odds ratios, which was 0.45. That means the mastoid obliteration could reduce with almost 50% the recurrence and residual disease. This outcome was scientifically, statistically significant. The p-value is low, and the confidence interval was narrow. And about the qualitative analysis, the hearing outcome, the complication rates, and the quality of life, we didn't find any significant difference between these techniques. However, the obliteration technique elongates the operation time. And the strengths of our analysis, this is the first comprehensive study, and more than 2,000 patients' data were assessed, and we use rigorous and thorough methodology. However, there are some limitations. We could only include retrospective cohort studies, and there is a heterogeneity regarding use for obliteration material and technique, and there is a high risk of bias according to Robbins I tool. In conclusion, we could say the mastoid obliteration could reduce the recidivism, and however, it elongates the operation time. And for the practice, it seems a good, effective, and safe method, but further randomized control trials are needed for verification. And the status of the manuscript. So we submitted in May, and the first journal asked for revision, and now we are waiting for the final answer. About the second project, which is investigating the predictive factors of the success rate after tympanic membrane reconstruction. So the reconstruction techniques are the type 1 tympanoplasty and laryngoplasty. These techniques don't need to reconstruct the ossicles, only the membrane. The prevalence of the perforation is 9 per 1,000 population. However, the success rate could be even 40 or 90%. And that's because various intrinsic factors have an impact on the outcome. And we would like to identify these factors. And with this knowledge, we could use in the patient education, and we can improve the clinical decision. Our clinical question: what are the factors that impact the type 1 tympanoplasty and meningeoplasty? Here you can see the PECO framework. P is for the patients who underwent these procedures, E is the group of patients with suspected factors, and C is the group of patients without these factors. The primary outcome is the success rate, which is the number of the fully closed tympanic membrane expressed as a percentage, and the secondary outcome are the hearing results. In the systematic search, we used 3 databases in November, and in the end, we found 39 eligible articles. Here you can see the combined results of all the factors. We could identify 10 factors from these articles, and we did forest plots, but because of the lack of time, I cannot show you all, so I show you all in one slide, and I would like to highlight only 4 results which were significant. And the first is the age between adult and children. The second one is the size of the perforation, over 50% or under 50%, and the third one is the opposite ear, if it was a diseased one with perforation or cholesteatoma or other disease, or it was a normal one. And the fourth is the experience of the surgeon. We compared the residents and the senior surgeon performance. And these 4 seems important. So summarize this project. The strengths is we include high number of studies, we include new clinical aspects, and we use rigorous and thorough methodology. And the limitation is the correlation between these factors has been not revealed because we could not do multivariate analysis. And this is the implication for the research. To do further research is prospective studies and revealing these factors connection by doing multivariate analysis. And the implication for the practice, with this knowledge, we could give better patient education, and we could do better clinical decisions. So the manuscript status, we are finalizing the draft, and our target of journal is the JAMA Otolaryngology Head and Neck Surgery. So here again, the 2 specific goals I have been worked, and the first one is submitted, the second one is going to be in September. And I would like to thank you for your kind attention with this quote. The improvement of understanding is for 2 ends. First is our own increase of knowledge. Secondly is to enable us to deliver that knowledge to others. And I'm happy to answer to your questions.
Kata, thank you so much, and congratulations on your progress. This is really stellar. I have a very simple question. You say that the first surgery, the mastoid obliteration, is a safe and reliable operation. So this implies that you recommend this treatment in hospitals, correct?
I cannot give recommendation because of the low quality of data, but in my opinion, that's a good technique and they should use, but yeah, I could not say in scientifically that, so I cannot give recommendations, sadly.
So my follow-up question would be, you recommend a clinical trial to be designed.
Yes.
What questions would that clinical trial answer so that we may recommend this operation?
Yeah, actually with the same outcome. The recidivism would be the main question. And of course, the secondary outcomes are so important, like the complication rates, if it's more or less.
My question is a comment, actually. Am I the only one in the room who recognize it's time to establish a registry on the field of middle ear surgery? Because you don't have data, you don't know the predictable factors either, so is it already established? Because it seems you need data.
In this field, in Hungary there is no registry, but in Sweden they are trying to establish, and they have some new articles about the meringoplasty, so we have some data.
So we could ask this in a different way, that is your group, I mean the group you belong to, I mean, have the possibilities to do this kind of registries in the future?
We didn't think about registry. We tried to do a trial in meringoplasty area, but further research is, yeah, maybe we are considering.
I also have a question. Were any of your results utilized in the practice in your hospital? Because you have some results that were presented here. Were these implemented somehow in the practice?
Well, in the Bajcsy-Zsilinszky Hospital, we are using obliteration technique, and we have some patients' results about that. And the meringoplasty, we will utilize.